Yeah, I would probably describe myself as, so-called the cautiously optimistic.
That is
Another big surprise for me was about how quickly we started to shift the idea of treating the disease to preventing the disease.
so.
ICBI is not trying to promote a material or a product. But Steve Jobs used to say, stay hungry, stay foolish, and that has been a motto of my career as well.
My dear friends, I'm very, very happy to have today Professor Alex Lin with me in our interview regarding the Global Congress, and we call this series Clinical Intelligence. And he's director of the Postgraduate Periodontics at the University of California, San Francisco. Actually, I was there last week when I visited Napa Valley. I was at a 60th birthday invited, and it's such a beautiful place. I love this city. And there is a lot of AI going on there with the self-driving cars. So that is really on the forefront. I think we can learn a little bit from this place. And at the ICBI Global Congress, you will have the co-lead of the scientific workshop together with Paul Henn from search data collection to publication. Your talk focus on the Congress is peri-implant health, what is, the most important we know today to screw an implant into the bone. And getting it also integrated is not the big deal anymore, but it used to be when I started 40 years ago. But today it's more about how can we keep everything healthy. So that is super important, and it's getting more and more important every single day with all the, let's say, the prevalence of the peri-implantitis, what is out there in the world. And your designated role in the ICBI board will be continuing education for North America and, of course, the community building in the US, and as well having, you're super young. As always I say, you're the rising star for me. You're the rising star, but your focus will be as well the next generation, because we have to take the next generation by the hand and lead them, guide them, get them into the academic world as well. And that is why the Congress is 50% about evidence. And you direct one of the most competitive postgraduate programs in the country. And I would like to start. What would none of your residents ever guess about you from reading your CV?
Okay, thank you, Ulrich, for such a welcoming and a nice introduction. So yes, I do direct the postgraduate program in periodontics at UCSF. We have 9 amazing residents with us. They are all very engaged in clinical care as well as research. So I'm very fortunate to have this responsibility for their clinical mentorship. From my CV, most people probably would think about I'm a person that's scientific heavy, doing different services and research. Really try to push forward the peri-implant health for our patients. But outside of my work, I'm a very curious person. I'm curious not about just dentistry. I'm also very curious about the nature. So I'm an outdoor enthusiast. I do a lot of, backpacking or rock climbing as part of my hobbies. So that's something that people would not probably guess from my own CV. Yes, but we always try to stay curious, not only just about our profession, but the whole world.
Okay. So I think the interior of San Francisco, like Napa Valley, is a very good playground for that, right?
Yes, totally. It is.
Yeah, perfect. Um, Alex, You boarded a plane from San Francisco to Nice for a conference where most of the participants had never met before, organized on, let's say, famously short notice. Be honest, how skeptical were you on that flight, and at what moment did you know it was worth it?
Yeah, I would probably describe myself as, so-called the cautiously optimistic. That is always very difficult for you to think about what the conference would go when you bring together so many different experts from all over the world. We have people from Asia, from Europe, from America. So it's always difficult to know how the direction of the conference would go. You want it to have really a meaningful consensus meeting instead of just a collection of the personal opinions. But what impressed me the most, immediately when we got into the room, everyone was very open-minded. Everyone was there to share ideas and even challenge ideas in between each other. So I would say they were also very willing to listen to others as well. So by the end of the first day, I realized this wasn't just about, defending my own opinion, that I want my opinion to be the dominant opinion. Instead, it was all about advancing the field together, thinking about what could be done and benefit our patients the most. And that's when I realized that, oh, this meeting totally worth the trip for me to go to Nice.
Wow, that sounds amazing. Really, I'm so happy to hear that. And I think that, yes, it's exactly how I experienced. Everybody was like humble on the same level. And it was from the very first moment a beautiful community. We had a beautiful evening, and we 2 days later we separated as friends. And after 2 days, that was really amazing. And I think the energy in Nice was as well like the ignition for creating the idea of the association, and to build the board where you are part of. And but let's go back to the content. What was, let's say, the most surprising discussion or insight that came out of those days in Nice? Something you didn't see coming?
Yeah, so when we had this discussion conversation in the room, surprisingly, we had so much agreement to begin with. Even people were from different areas, different continents. But we felt that we had a very similar difficulty when facing implant dentistry. Another big surprise for me was about how quickly we started to shift the idea of treating the disease to preventing the disease. So we started to have the conversation moved beyond just the implant disease. We start to have conversation about the different materials, even the broader concept how to prevent peri-implantitis through better diagnosis, better treatment planning, better patient selection, better material selection, and the better patients the maintenance program. So let's shift towards the prevention rather than just simply managing peri-implantitis or complications was very refreshing. And that was something that surprised me pretty early in the conference.
What is, Alex, in your opinion, the big chance of the ICBI as a very I mean, it's yet not born because the board will be starting the work right the day before the conference, to invest time and effort and energy as a board member into this young ICBI association. What is your, yeah, what you think why this association is worth to be part of it for you personally?
Yeah, so I'm a relatively, a mid-career young academician, and as a person who is in full-time academia, I always ask, what is the evidence? I mean, when I teach my residents and when I teach dental students, we always try to really teach evidence-based dentistry. So what convinced me the most from the ICBI standpoint, ICBI is not trying to promote a material or a product, but it is something that's trying to create scientific platform for discussion. And so we needed to value this opportunity. And then that distinction was very important to me that we are not doing something more commercially like a oriented. At the same time, we also want to really push forward how to really maintain this scientific rigor. Because if we are gonna talk about evidence, which would be really important for us to practice clinically, we should always distinguish the established evidence from just the promising concept. We should practice evidence-based dentistry, and ICBI could be a good platform to really initialize this concept, this idea, and potentially we will be able to collect more data, document more clinical cases, and provide a long-term evidence database for our future practice. So I think that is a great opportunity for people being involved in ICBI. And in the long term, we would have to evaluate objectively and transparently how different materials influence the patient outcomes, influence the clinical outcomes.
Yeah, absolutely. And that is something I just can 100% support. And I believe that especially in the ICBI, we have so the members all together, they have placed far more than 100,000 ceramic implants. And we could see how we, and not easily, but it was hard work, but we were able in a quite short time to document more than 450 implants in the retrospective study. You're in close communication with Paul, who was spending some night shifts in the past weeks, and the data is very, very promising. We're not allowed to talk too much about it, but it's very promising. And I mean, I'm coming from the practical side, but I learned in the past 25 years one sentence, that is, show me the evidence. And that is something what in my second part of my career, what I want to put my focus on. And I think that's we have to bring both together. I mean, you're a periodontist, and peri-implantitis is one of your daily battlefields, let's say. And a very straight question, what is a little bit will be soon answered by the retrospective study. The difference you see around ceramic versus titanium, is it hype what the ceramic community is talking, or do you believe there could be a paradigm shift waiting for us in the future?
Yeah, I think it is very probably too early to call it a paradigm shift, but I certainly feel it is more than just a hype. Titanium remains probably still the dominant, or we can even call it the gold standard, because of its long-term evidence. We have been using titanium implants for at least the last 40 to 50 years, and with that long-term evidence, that's really why titanium implants are still considered the first choice when clinicians think about the treatment planning. Ceramic or zirconia implants have shown quite encouraging biological and aesthetics outcomes from our patient treatment standpoint, particularly for soft tissue response to the material, as well as the minimal plaque accumulation around this material. So I do think there are some promising results shown from a different case report. However, the key question is which material is potentially better for certain case scenario. I don't believe that one material is universally better than the other, but we always need to put patient in the center of our thinking process. Each patient may have different demand. Each patient may have different fit in terms of the material response. So if we can have our patient as the center of our treatment planning, then we should choose the ideal, the most suitable material for a specific patient. We need more probably high quality long-term evidence clinical trials before we changing the clinical standards. But yes, I do think zirconia or ceramic implants are one of the most promising alternatives when we compare it to the current gold standard, the titanium implants. But hopefully, the more long-term data and clinical trials would be published soon in the future so that we can have more evidence to think about this treatment option.
Yeah, absolutely. I support this 100%. I mean, for me, it was as not coming from the academic world, it was super surprising for me. First time 2023 at the consensus conference of the AO in Chicago, where I was part of the ceramic group, that out of 1,671, just 13 studies were considered to be useful for a consensus. And it was, I think, the same ratio, 1 to 100. A niece who had something like 2,500, and we used something like 20, 25. What a waste on time, on effort, energy, even maybe some lives if it comes to animal trials and so on. And I think we have in the future to do a better job. That is what we are planning with the prospective study. So to kind of create a protocol, what we hope other scientists are going to use as well, because we could then compare data in the future and create a bigger database. Because the next big step in ceramic implantology is the evidence. And so my next question is more like an academic question, because I think I know your answer already. That I mean, the US, the ceramic implant market is still a niche below 1%. And what will it take for American clinicians to take them seriously? I mean, I know your
Yeah,
answer.
yeah, this is a really great question and kind of tricky question because I believe that in the United States, clinicians, we are very evidence-based driven. And whenever that we really do procedures, protocols, especially when really changing from one protocol, very established protocol, such as, titanium implant placement, to zirconia implant placement, we always ask, okay, tell me where the evidence is and what are the long-term outcomes. Like in my answer before, we really needed to have more well-designed clinical trials with long-term follow-up, and we need to have the broader educational opportunities to our younger generation, our younger clinicians, and we also need clinicians who are properly trained in different case selection. So I think ICBI, what we are trying to do is a good cornerstone to really build this foundation. Because if we do want to really expand the market, then in the US, we need to really show more human clinical trials so that we are able to predict or even assess the outcomes for our patients' benefit. So another thing that we need to think about would be probably the educational opportunities. I believe that there could be opportunities we could talk with different universities and see if there could be opportunities for collaborations so that we can also evaluate new technologies or new materials, not just trying to promote them, but really testing them scientifically and potentially educate our residents about critical thinking and different material options and the protocols. And I think that there could be another platform that we could advance the use of the material.
Mhm. Yeah, absolutely. About training, use the word. This is like the scientific workshop. I'm really excited about the format, what you put together with Paul. And I mean, the idea that with kind of uh, uh, yeah, some homework, uh, you will yeah, the participants will have to take care of. And then, but during the 2 days, the idea is that they would leave with a base for a publication, a poster, whatsoever. And you and Paul, you're going to support those participants in the following months for their publication. And I mean, I learned many years ago from a very intelligent man. He told me authority comes from author, and you have to write if you if you want to be seen and recognized. You have to write and you have to publish, and that is something what I think we practitioners we should learn to properly document, because otherwise it will just drain into the soil and will be gone. And then be able to yeah, then to use the data for publication, for posters, whatsoever, case presentations, but everything on the scientific, evidence-based level. And I think that is something, looking back, if I would have had the opportunity to attend a workshop like this in the past 35 years, I would have, applied for it. And so, what is your personal, what you think is the most precious, um, thing and learning what the participants are going to take home in this workshop or from this workshop?
Yes, for sure. So Dr. Paul Henn and I, we want this workshop to be really practical for clinicians. We plan to really review the most recent evidence published in the literature, and we also want to discuss challenging clinical cases, scenarios, and focus on how to really translate the science into our daily practice. And in addition to that, like you said, it's always really difficult to really perform good data collection and the documentation from a scientific publishing standpoint. In order to really have more evidence in the cornea implant, we really have the goal to really teach clinicians when you really have your daily practice seeing patients, how to really document a case well, how to really collect data well. So your clinical practice data set would be able to potentially implement into a scientific writing standpoint. So we will be able to translate that part of the evidence into a scientific writed evidence, potentially for journal publication. So our goal is that participants would leave the workshop not only knowing what literature says, but how to really apply it and even potentially being able to contribute to the evidence. So whenever they sit in front of the patient, they already know what kind of documentation they need to perform, what data, what parameters, what variables need to be recorded, so that this kind of data set would be able to be a structured data set for the future publication standpoint. And hopefully by doing so, we would be able to have more evidence in the cornea implant like you just mentioned. And with more evidence, then we would know from the patient treatment standpoint how we can really benefit our patients in the long term.
Yeah, wonderful. That's a brilliant perspective for the participants. And uh, I mean, our global congress is like evidence and intelligence. So yeah, I believe the word of the year 2026 will be intelligence, because it's in artificial intelligence, and everywhere it is used so often. And I think it's important. And the more artificial intelligence are coming, the more emotional intelligence will be important. So there is always as well a border. And I mean, you train the next generation of specialists, and of course, your residents they use AI in their research. And where would you personally draw the line between a brilliant tool and a shortcut that produces clinicians who can't think? Um, and what must still be learned the hard way? What do you think?
Yeah, so artificial intelligence, AI is such a huge, such a powerful tool or assistant, but I never really think about AI as a shortcut, and it should not be used as a shortcut. It should never really replace the critical thinking from human beings. So I always encourage my residents to really, use AI to really make their educational experience more enriched. They could use AI to, organize information, sometimes used to summarize the literature, improve communication potentially, but they still need to really understand, the study design, the statistics, biological principles, treatment planning, clinical judgments. So all these components are not able to be done by AI. So AI can generate answers. Yes, we all know that AI is very, very generative, but it cannot really assume responsibilities for patient care. And sometimes AI do make a mistake or errors as well. Sometimes you use AI to search for answers and you realize that the AI is not really accurate. And sometimes you use AI to really summarize articles for you. You could potentially see some fake references or citations from the AI generated script. So we needed to be very careful when we use AI, and the human beings, that critical thinking component would never really be able to be replaced. And for patient care, we all know that clinicians have the most responsible role in this treatment planning process. So this responsibility for the best patient care always belongs to clinicians. It's not something that AI can really replace. So I think we all needed to really be living in this AI world. However, we need to be able to embrace AI while we have the lead to really make sure that we take the responsibilities for our patient care while using AI as the tool for us to really advance the health for our patients.
Yeah, absolutely. And this will be as well a part of your topic at the scientific workshop, and I think that is super important because Jörg told me that sometimes when he is reviewing publications, then he could still see some typical what he could directly reflect to ChatGPT. So that is definitely not the way we want to do it on the scientific workshop, and we want to use it in the right way, and we have to learn where is the limit and how to use it properly and as well on a scientific base. Yeah, Alex, we're coming to the end of our interview, and at the end of every episode, we give a gift to our viewers, a book, a film, a habit, a quote, or a life principle. What you like, what shaped you, what would you like to leave with us?
Yeah, so I want to get back to where we started. As I mentioned, I'm a very curious person and I live in the Bay Area. This is Silicon Valley area. So Steve Jobs used to say, stay hungry, stay foolish. And that has been a model of my career as well. We always need to stay curious. As we all know, dentistry is a really continuously evolving world. Thinking about where we started, we didn't even have any periodontal regeneration. Now we have been using regeneration therapy for almost multiple scope of treatment. We didn't really have dental implant. So nowadays we have dental implants. We not only have dental implants, we have different materials of dental implants that's being very promising. And in the past, we used to do a lot of intraoral impressions or treatment planning, but now everything has been quite digitalized and making the workflow much easier and much straightforward. So AI is coming even into this part of our generation, into our treatment planning for our patient care. So I think we always need to stay curious, trying to our best to learn new stuff and make sure that we stay on top of the technology. Because I always tell my residents that every patient is a great learning opportunity for them. They could always learn something new from the patient care. So if we all stay humble, stay curious throughout our career, then we will be able to keep learning new things, and we will be able to use the new technologies, new ideas applying to our patient care and provide our patient state-of-the-art treatment planning and the therapies, and then make us better clinicians, better teachers, better scientists. And that's what I want to share with everyone.
Wonderful. What a beautiful last words for this interview. Alex, I thank you so much. It was a great pleasure to talk with you, and I think it will be very informative for our viewers, for our community. And yeah, I'm very much looking forward to see you again in person at the Global Congress end of October. And I wish you all the best until then. And yeah, see you soon.
Yeah, thank you, Rich. And I look forward to seeing everyone in Zurich as well. So hope to see everyone in Zurich and take care.